here at Gallaudet University's Kellogg Conference Center for the Office of the Tenant Advocate's first annual Tenant and Tenant Association Summit. Stay tuned for an exciting mix of interviews featuring elected officials, conference sessions, and tenant activists. We're here with Jane Malone of the Alliance for Healthy Homes at the Office of the Tenant Advocate's first annual Tenant and Tenant Association Summit. Welcome, Ms. Malone.
Thank you. Thank you. It's great to be here. Great turnout.
Tell us about the work of the Alliance for Healthy Homes.
Well, the Alliance is a national nonprofit public interest organization. We're about 16 years old. We were originally the Alliance to End Childhood Lead Poisoning. And what we do is basically promote protecting people from hazards in their own home environments. And the big pieces that we work on are encouraging and helping communities to develop effective public policies to deal with hazards in the home environment, like landlord-tenant policies, and also to build capacity to help people, communities, to be able to identify hazards and fix them where they need to be fixed and prevent them, most importantly.
And one of the big issues you deal with is lead. Talk about that and how that impacts tenants in D.C.
Well, lead poisoning is a terrible problem, of course. It's caused by lead-based paint in the home environment. There are other issues like toys and so on, but the big problem is still lead-based paint in the home environment, particularly in a place like D.C., where most of the housing stock was built before 1978 when lead was banned. We have here in D.C. around 750 children a year that we know are affected by lead because they have lead in their blood that is at a dangerous level. They have what's called, more than 5 micrograms of lead per deciliter blood, which is a big warning sign. Used to be, everybody said the big warning sign was if the blood lead level was 10, but now we know more and more from current research that any level of lead exposure is dangerous, and we need to pay particular attention to children more than 5, the number 5 blood lead level. Basically, there are a couple different opportunities. First of all, tenants in D.C. can do and should do 3 big things to protect themselves and their children and children who visit the home. First of all, children under 6 need to be tested for lead. While it's not a good thing that they're possibly exposed, it's better for us to find out and deal with the problem in the home than not find out. It's really, really important that children under 6 be tested for lead. Right now, about 30% of the children in D.C. are getting tested. That's not right. And the lack of testing is citywide. It's every ward. It's not just like there's a couple wards where no one's getting tested and everywhere else is doing fine. Across the city, kids are not getting tested for lead. It's a big problem.
And where do people get their children tested for lead? Is that something that's part of your basic health care?
Yes. Well, first of all, Medicaid is supposed to cover it. So anybody who's in that situation, their health care provider should be getting that test done. There are a lot of offices where they don't do the testing in the office. They don't have that capacity. And those offices then refer the family to take their child to a clinic or another kind of facility where they can do the blood lead testing. And that's one of the big problems is that, when you don't do it on site, it gets lost in the shuffle. The parent doesn't get around to making that additional appointment to get the child tested. So we've got a big problem in terms of the disconnect between the doctor's offices and whether or not they're making those referrals. But there's also a question whether the referrals are being made, so it's sort of a big issue. The test does not take a lot of time. It's not very intrusive. It's really, really important those tests get done. The other 2 big things that tenants can do to protect their families from lead are to pay attention to whether there's peeling paint in the home environment. Now, obviously, people who are tenants are not responsible for, and in fact, in many cases, aren't allowed to do things like, do major paint repair and repainting and so on. So this is often a property owner responsibility, which is why in the D.C. Housing Code we have a provision saying that rental properties should not have peeling paint. Peeling paint needs to be fixed. The other big thing is to watch out for whether someone is doing work in the home environment. They're, doing some repairs where they're taking some initiative to hang something on the wall maybe, or maybe they're moving some furniture around, they smack a piece of furniture into the wall. Any of those things that people do in their homes that can cause a painted surface to be broken or in some ways, affected, that can cause deteriorated paint and invisible lead dust to get around. So there's 2 pathways. The invisible lead dust caused by peeling paint and the invisible lead dust caused by people doing some work that's causing the painted surface to be broken. Those are the 2 big things people need to watch out for in their own homes. We have pending a piece of legislation, a bill that was introduced just last week, which was late September, by Councilman Graham. The bill has 9 co-sponsors, so it's got already widespread support, and this bill will require property owners to, among other things, pay attention to lead, to deal with peeling paint. Basically, right now, the idea in many laws is, well, if someone can prove it's lead, then the property owner maybe needs to deal with the lead. This bill will kind of reverse the accountability and say, if there's peeling paint anywhere in pre-1978 housing, then the property owner has a responsibility for dealing with that. The law basically will presume that that paint must have lead in it, and unless the property owner can prove there's no lead, then the property owner has to deal with the peeling paint and fix the peeling paint using lead safe work practices and get a clearance test. So it's sort of shifting the onus from right now what's on the books was just kind of no peeling paint, which nobody ever enforces, to let's pay attention to peeling paint if it's in pre-1978 housing and make sure we clean it up.
You know, and that's, I think, a very important issue, because you could look at peeling paint and think it's just an aesthetic issue, that it's something that you let go, that it's not that serious. But if you see that peeling paint actually exposes you to lead dust, which is how it can get into your system, is that something that affects adults too? You talked more about the impact on children, but can adults be impacted by lead poisoning?
Well, the last question, adults can be affected. We know studies have been done showing workers who work around lead-based paint, one of the major issues actually is reproductive problems. It causes impotence. It causes basically inability to have kids. And then in terms of children, the health effects are very severe. First of all, it basically damages the brain. That's the main problem with lead. It makes kids have learning problems, attention deficit disorder, other kinds of behavioral issues, but also IQ points. Lead costs children IQ points. Basically, the child who's been exposed to lead, sitting in a classroom next to the child who hasn't been exposed to lead, has a harder time in school, less chance of doing well in school. So that this is a disease, lead poisoning, that really debilitates children from having a future, having the ability to work, the ability to get to finish school, to do well.
All right, thank you so much. Jane Malone, Alliance for Healthy Homes. We hope you enjoyed the conference. For more information on the Office of the Tenant Advocate, visit the website www.ota.dc.gov.